Hello everyone, my name is Dr. Mary Van. I am the clinical director at ThriveX Medical. We are experts in infusion therapy. My doctorate is in pharmacy and I am also a diplomat of the American Board of Clinical Nutrition. This presentation is intended for healthcare professionals. However, if you are a patient, you are more than welcome to watch, of course, but I am not giving out medical advice. There has been a lot of interest in how to utilize ascorbic acid. Most clinicians usually utilize oral routes, and I will go over that briefly. In our office, orally, we'll recommend anywhere between 1,500 milligrams to 4,500 milligrams for our adult patients. As with all therapies, you want to make sure that you start low and you go slow. Again, ascorbic acid is an acid. Therefore, if you give someone too much acid too quickly and they haven't built up tolerance, you risk having some unfortunate side effects such as stomach ulcerations and stomach bleeds. Also, the higher you go in terms of dosing for ascorbic acid, the more diarrhea can occur. So as clinicians, we have to be mindful of that because the last thing you want to do is to cause the patient to become dehydrated. So just remind them, just go slow. In terms of when to take the dosing, it is important to tell the patient to take ascorbic acid with the fattiest meal of the day. Number one, it decreases side effects, but also you can take advantage of the presence of the acid. During this time, during lunchtime is usually when I recommend it, I'll tell the patients to take their other supplements that are fat soluble. Those include vitamin D, vitamin E, vitamin A, vitamin K, CoQ10, and omega-3. I'll also ask them to add on other nutrients as well, such as magnesium, zinc, iron. All of these supplements love the presence of the ascorbic acid, so by doing it all at the same time, you're going to help pull greater amounts into the digestive tract to help improve absorption. Now, I'm not going to go into the mechanism of action and the history of it. What I'm going to do instead is include a link to a presentation by Dr. Paul Anderson. Dr. Anderson is probably one of the most famous naturopaths. He is extremely experienced utilizing ascorbic acid, and he does a great PowerPoint presentation describing its mechanisms of action, how it helps support both the innate immune system as well as how it helps regulate the adaptive immune system. And he also reviews briefly the clinical studies that are being done in China. Here in the United States, what we're finding is that many hospitals, I think the New York Post actually reported it, that several of the hospitals are utilizing 1,500 milligrams 3 to 4 times a day in the intensive care unit in patients who have been diagnosed with COVID-19, and they are seeing some clinical benefits. In our office, we actually start around 10,000 milligrams, and we will dial up the amount of ascorbic acid, 25,000, 50,000, upwards, based on our patients and their relative needs. And I wanted to go over not the mechanism of action, which I will leave up to Dr. Anderson to do in his PowerPoint presentation, but instead I wanted to make sure clinicians understood what are the monitoring parameters, directions of use, and also side effects. So monitoring parameters, you want to make sure that every single patient that you're going to start an infusion on, you have at the very minimum a CNP and a CBC, of course, but you also want to make sure that you're doing genetic testing. You want to make sure that you are doing G6PD genetic testing on every single patient. And the reasons we do this is because it occurs in 1 in 20 people on the planet. And patients with this deficiency will unfortunately risk having hemolytic anemia due to oxidative stress the higher the dose of the vitamin C. You also want to make sure you're pulling 2 additional markers in addition to all the other markers you're pulling, and those 2 markers are highly sensitive C-reactive proteins and elevated LDH. Both of these are traditionally very high in patients with the COVID-19. And the problem is that if you start off someone on high doses of vitamin C who have these 2 markers, you are again risking hemolytic anemia. So it might be a better idea to start them up on a lower dose, and as their inflammation drops, then you can start titering up that dose, because as you remember with hemolytic anemia, it doesn't always occur at the same time you're giving the infusion. In fact, it can occur hours or even days later when the patient may not be attended to. And so we really just want to decrease any possible risk to our patients. In terms of building formulations, I am going to include a link to a formula that is published and that has been utilized. However, you should create your own formula because every therapy needs to be tailored to that specific patient. But I would like to remind you gently of 3 things when you're doing IV therapy and building those formulas. Number 1, you have to make sure that pH is correct. Remember, anything too acidic or too basic will literally cause the cells to die upon contact. Number 2, you need to make sure you're checking osmolarity. When you're building up these formulas, you have to remember that ascorbic acid is an extremely heavy molecule. If you push that osmolarity too high, you're going to blow the vein. So you got to make sure you give that IV nice and slow. And you got to make sure that the osmolarity isn't too low, or then you also, again, risk hemolytic anemia. And last but not least, and this is especially important when we're dealing with patients with COVID-19, is fluid load. Traditionally in pharmacy, we say never shift the patient's overall volume by 20%. But in this particular situation, where you're dealing with patients with possible congestive heart failure, where you need to know what their ejection fraction is, or you're dealing with patients in acute respiratory distress, we know their volume tolerance is extremely low. So you need to make sure you're working with your compounding pharmacy or your pharmacist or whoever your IV expert is to make sure you're coming up with a formula that's not going to put too much fluid burden on the patient. And lastly is side effects. Because we are pushing higher doses, you have to be mindful of a few side effects. Number 1, dehydration. I know that sounds paradoxical because we're giving them an IV, but dehydration can rapidly occur with ascorbic acid. Number 2, this is the most common side effect you're going to notice, hypoglycemia. Again, that's hypoglycemia. Ascorbic acid and glucose are almost identical structurally speaking. So therefore, it is extremely common for the patients to have that drop in blood sugar, and it's quite a sudden drop for some of our patients. And it's important to know that you cannot use a blood glucose monitor on those patients because the readings will be false. When we give patients infusions of 40, 50,000 and higher of ascorbic acid, it's very common for the blood glucose monitor to read 500, 600, or just completely off the scale that it's unreadable. So do keep that in mind for your patients who are what we call PO, they can eat. By all means, make sure that they're being well fed. For your patients who are NPO, you want to make sure that you are giving them maybe some D5 or some D10 to compensate for that blood sugar loss. And last but not least are your side effects associated with hypocalcemia. Ascorbic acid is very chelating, mild, but can be very chelating when being given repetitively and at high doses. So for hypocalcemia, you remember the mnemonic CATS, C-A-T-S. C is for convulsions. You certainly could induce a seizure. A is for cardiac arrhythmias. Arrhythmias can certainly occur, not very common, but they certainly can occur, especially in your fragile and your unstable patients. T is for tetany. Again, this is a chelating agent, so you do have to be mindful of watching for tetany, and of course those tetany, traditional tetany signs, including Trousseau's sign. And last but not least is stridor and spasms. You always need to be mindful that you are always watching your CATs. I really hope this presentation helps you as providers and clinicians. I hope this gets everyone better or more comfortable with doing ascorbic acid infusions, and certainly everyone be safe, and we look forward to helping you in any way we can. Thank you.